Hello, and thank you for making the time to be with us. My name is Marie Yambo. Our social media handles at Marie Yambo at KBC Channel 1 on X and KBC Channel 1 TV on Facebook. Now, today we want to talk about universal health coverage with a particular interest on community healthcare. And to speak to us about this is Dr. Maureen Kimani. Thank you so much for making the time to be with us, Dr. Maureen.
Thank you, Marie.
And first things first, what is universal health coverage?
Thank you very much, Marie, for having me on the show and having the ministry on the show. So universal health coverage is ensuring, in simple terms, ensuring that all Kenyans have access to quality health care, first at a cost that they can afford, but also very importantly, without incurring financial catastrophes. For example, without having to sell everything that they have because they got sick. Now, sickness is leading them to poverty. So basically, access to high quality services without suffering financial hardships, and also ensuring that the services are affordable, they're acceptable, they've been well designed to meet the needs of the community, and also that the community are also participating in the provision of that health.
Okay, and you've correctly put it. The community has to be part of, their own healthcare, if I may put it. And so that is where the community health strategy comes in. In a nutshell, what does that involve?
So the community health strategy is first a people-centered approach to care, where in primary health care we believe that community participation and community involvement is critical for achieving full health, because we also know that health does not begin at the hospital, but health begins at home. So one, the food you ate today morning, what you took at lunch, what you're gonna take at dinner, that is part of health promotion. That if we have good nutrition for everybody in the country, then we've already achieved in a big way in terms of preventing illnesses and ensuring that people are healthy. The second thing is issues such as washing hands, for example, having a toilet, keeping your environment clean. All those are issues that cannot be done in the hospital but have to be done at home. The third thing is around issues around water, for example. Drinking safe water is a critical component of health. And if you look at our disease burden in the country, we are still suffering from malnutrition, so we are not eating well. We are still suffering from diarrheal diseases. I'm sure in the recent past you've seen cholera cases or kipindupindu on the rise and so forth. Those are just issues of environmental cleanliness, having safe water. So those basic things are what community health really tries to look at. And in addition to that, we also know that people need to be supported to understand health. And that's why we've brought in the issues of community health promoters. These are community members who have been selected by their communities, because why we do it in that manner is because you need to be living in that community, understanding the issues the community members face. They understand the environment, they also understand the language, for example, and also the culture, because there are cultural nuances that make people to seek help or not to seek help. So they understand that. And so after they've been selected, then the ministry has a training package.
Okay. Just before we get into the training of the community health promoters, there is a very big emphasis, especially with the UHC, which is the theme of the Mashujaa Day celebrations. And there's a very big emphasis on the issue of promotive and preventive health. So what's the difference? Promotive, preventive, and curative? Yes.
Promotive, preventive, curative, rehabilitative, even palliative care, all those are components of health, But the first and initial component that we usually start with, which for a long time has not been given its place in the health sector. So there's been now a move or a renewed focus on prevention and promotion. And basically prevention is about, we know, for example, issues around vaccination. So we know for some of these diseases, if we don't add, if we just wait for natural immunity to occur, then we're going to lose a lot of our babies. So one of the big programs that the government has is around vaccination. And we know that for the entire population, all our under 2-year-olds are supposed to undergo mandatory vaccinations to prevent against some common illnesses that we have in the country that would cause a lot of deaths if we were not doing anything. So that's one of the prevention programs that has been there. We have other prevention programs, for example, in HIV world, for example, you know about PrEP, where if you're at risk, you know you're at risk, you're able to take some medicine and you will prevent your chances of getting HIV. Yeah? Issues around health promotion include things like taking safe water. It's a health promotion activity. Yeah? Taking good food, having optimal nutrition, nutritious food is also part of promotion. So those two, we combine those two. There's some components that are heavily home-based or community-based or at family level you need to do for you to prevent and to promote. But then there are also things within the hospital, like I've given example of vaccination, PrEP, for example, that help us to also prevent some of these public health threats that we have in the country.
So when you're speaking about promotive and preventive health, definitely you've well explained it, that there are certain programs that are essential, like vaccination, and especially when targeting the under fives and all that. But at an individual level, at a community level, and can I say even at a national level, what then are the benefits of embracing promotive and preventive health at that level?
The benefits are quite immense. Number one, if you are taking nutritious foods for you and your family, just using locally available foods. You don't have to take fancy food for you to be healthy, but just look what is locally available. And nowadays we're talking about a variety of foods. Before we were talking about balanced diet. Now we are saying take food from variety of the food groups that we have. So one is that, of course, you're going to reduce your chances of getting sick and therefore reduce the hospital visits that you have to make. And of course, that also reduces your healthcare cost, because healthcare costs are not just about what you paid at the hospital. It's about the transport you use from your house to the hospital, the loss of income. If you are a mama mboga and you had to go to the hospital for 5 hours, you'd have sold whatever amount you normally sell at that point. If you are employed, that's man hours that are lost where you could have worked, but now you couldn't work because you went to the hospital. So it will also increase productivity, for example, because now if you're healthy, then health is wealth. You can be able to do much more with the energy that you have because you're not sick. So basically, we have lots of gains to make as a country. And one of the things we've done as a ministry is to do a return on investment for community health. So we did a lot of studies and found out that if we invest just 1 shilling in community health, that's basically in prevention, promotion, identifying conditions early before they become complicated, then we can save up to 9 shillings. So we have a return on investment of 9 shilling. Imagine if you invested 1 shilling, at the end of the year you get 9 shilling. You can multiply that by 50 million Kenyans and see what magnitude of production, and that's both in the short term and in the long term. And the other thing I want to say, you see, for a lot of prevention programs, you don't see the benefits immediately. It takes a long time. For example, for under fives, you'll make sure that the people who are born today, they actually live to see their 5th birthday because they are not malnourished, They didn't die of pneumonia, they didn't die of diarrheal diseases, and so forth. So I think we have a lot to gain in terms of ensuring our population is healthy. And if people are healthy, they are more productive. And if they are more productive, the country will have more money. And of course, we reduce the healthcare costs, because our healthcare costs have been increasing, but of course, our GDP is not increasing in the same way. And that's why a lot of our countries struggle to meet the 15% allocation to health, because we don't have enough money. Our people are still sick, and they are sick because of common illnesses.
Which again are actually diagnosed quite late.
Yes.
So the community health strategy and the promotive and preventive health, like you're putting it, is supposed to prevent people from, incurring higher costs because of not, can I say, of lack of, lack of early diagnosis.
Early diagnosis, and also they are becoming more and more empowered in health issues, because when the CHP comes to your home, they will educate you. As I've said, we have a training package. In the training package, we educate them on key messages that they can give you around issues of pregnancy, issues of taking care of a child, issues of nutrition, non-communicable diseases like hypertension and diabetes. So they are able to give you ongoing information, and it is not one-off. It is every time they come to your home, they inform you or educate you. And with time, those things become internalized. And ultimately, that's one of the ways that we can change behavior of our communities, so that everybody knows from the time I'm young up to whatever age, I have to behave in such a way to maintain my health. So that's the essence of what we are trying to do. And I'm sure with time, we shall see the benefits of investing in community health.
And you've talked about community health promoters. These are the community members who have been appointed by the community themselves to be able to, assist them in as far as, healthcare is concerned. And you've rightly put it, they're trained to a certain level that they're able to identify, but their work is to refer and not to treat. Now, there's another challenge that most Kenyans have, and that is, accessing healthcare, going to the hospital. Some hospitals are very far off. And so what then would you say is the role of community health promoters in ensuring not just access, but equity in terms of, healthcare seeking? Yeah.
You bring a very important point about we have marginalized communities in Kenya, where probably a mother is in labor, has to walk for 20 or more kilometers, and they don't understand that entire process of accessing the facility. So what we have tried to do is to make sure that we link our community health promoters with the local health facilities, so they are not working in isolation. So if they go to the community and find a mother who is in need, and of course the facility wouldn't know, because you are somewhere 20 kilometers away from that mother, then they are able to call the facility, and if there's an ambulance service within that area, then that mother can get into that ambulance and be able to be attended very quickly. The other thing is that community members have also become very innovative. There are some who have border taxis, and therefore they're able to contribute and take this mother to the facility. There are also others who have donkey taxis. They can be able to get the mother onto the donkey and go to the facility. So I think this entire community health system is helping even communities to understand some of the dangers that women face in those very far off communities, where there are challenges of infrastructure, there are challenges of access to health facilities, and therefore by doing that, we're bringing equity and ensuring that no mother or no child has to die because of lack of access. So the community health promoters provide that very clear link with the facility. So again, they don't work in isolation, and they're able to look at what are the other resources within the community beyond health. Yeah, the tax, the border tax is there. Can we collaborate with those? And there are actually people who have done very well in ensuring that women and maybe sick babies don't have to suffer at home because of transport issues, which we know are a major concern in many of our communities.
And even as we are about to wind up, we talk about recently the president did flag off about 100,000 kits for community health promoters. How key is that, to the work of community health promoters, to enhancing healthcare at the community level? And even as you answer that, let's talk about NCDs, because that's also another very big issue, that people end up very late, whether it's cancers or diabetes type 2, high blood pressure. How then are the community health promoters very important in identifying those areas quite early?
First, I'd want to say, I think we also, the CHP kits are being flagged off on Monday for distribution to the 47 counties. And one of the things I'd want to say is we really appreciate that move by government, because it's really a game changer in that community health promoters before were just giving you information. They couldn't screen because they didn't have any of those things to screen. They could just identify this as a danger sign and tell you, okay, go. But then you may say, it's not so a big deal. I'll go tomorrow or the other day or the other day. That other day maybe never reaches for you, or by the time that other day reaches, you are in a critical condition. So what the kit is going to do is to help them to do their work in a much better way, because in their training, they are taught on how to do basic things. For example, taking temperatures. If a mother says, I think today my baby is not so well, so there are quick things that you're able to check, like do they have a fever? Just simple things like those, which before they couldn't be able to do. Also, there's something around nutrition assessment. So before they could give information, eat well. These are the food groups within this community which you can be choosing from. So because they actually come and show you. But now they can do nutrition assessment. So they're able to take what we call the MWAC tape for the child, the mid-upper arm circumference, which is a simple tool for measuring the nutrition status. You're able to understand, is the child okay nutritionally? Are they moderately malnourished, or is there severe malnutrition? And they are able to refer appropriately. The other critical thing is that in case there are issues around diarrhea, for example, yeah, if the mother says my child is just passing loose stool for the past maybe the past one day, then there are basic medicines that are given to such children, which is zinc and oral rehydration salt, just a simple salt and scurry, which people normally koroga in the house, but now there's a medicine that is actually well constituted to ensure there's rehydration for any child. And of course, if by tomorrow, if it's worse, or in the next few hours it's worse, then the baby actually is referred to the facility. But if it's just okay, they take we call it ORS and the zinc tablets, and they're okay, then the mother can just continue doing their everyday activities. The other very important thing that is in the kits is we can be able to take weight. They can now take weight before they couldn't, and that's part of the nutrition assessment. They can take weight for the adults and weight for the babies. But in addition to that, we also have the big issue around NCDs. Majority of Kenyans only get to know they had blood pressure or they had diabetes when they actually have the disease. Because if you took a sample in the street right now, ask anybody, have you ever measured your blood sugar or your BP? They probably would say no, unless they have ever gone to a facility. And if you look at the proportion of people who go to facilities compared to the entire population, it's a very small proportion. So we actually need urgently to start educating our people to take some of these measurements seriously. And that is why within the CHP kit, there's a glucometer and there's a BP machine. And again, they have been trained on how to take the measurements and have the basic information around what is high and what is low or what is normal. Yeah. So if it is normal, they're able to tell you this is okay for now until next time when they come back for a test. But if it is high, they're able to tell you, you go immediately to the facility for further investigations. So it's just a way of early screening, and now the CHPs will really be helping us in that aspect. When, of course, it comes to hypertension again, a lot of people know they are sick when maybe they got a stroke or they had this headache and now it was really bad and now they went to the facility. But most times, many people don't know until they have a stroke, for example. Yeah. But this, the BP measurement, the screening, which will be done every time the CHP comes to your house, will really help us as ministry to know generally the general population, how are we doing in terms of NCDs, and also to ensure that the people who are sick or are starting to get sick are referred very early to the facility.
Okay. Thank you so much, Dr. Maureen Kimani, for that comprehensive explanation about what community health strategy is all about, and also the role of community health promoters in as far as promoting health in the community, and their role also in achieving universal health coverage. And you've rightly put it, it is now coming at the individual and community level, and that in itself, preventive healthcare is key, to benefits not just at the national level when it comes to the health sector, but also economically to the people at an individual level. Because then if your NCD is identified early, you prevent the issue of WhatsApp groups and harambes and even spending, for instance, at savings, and the complications that come.
Are undergoing dialysis.
Yes.
Because of some diabetes, which was never, or hypertension, which was never identified early.
Yeah. So if that is with the community health strategy, then if it's strengthened because it's been there for a while.
Nilianza 2009 na wakati huo nilikuwa kujaribu kwa sababu na remember wakati mwingine anko yangu aligonjeka akawa akona TB na brother yangu mkubwa alikuwa anatuzuia tusiende karibu na yeye na alikufa nikiona. So from there nikasema mimi lazima nikuwe daktari ili nikaweze kusaidia wengine nisione vile anko yangu alikufa. 2012 ndio sasa community strategy iliweza kukuja mashinani na watu wakaanza kufanyiwa trainings, na sasa ikawa officially tulikuwa tunaitwa community health workers, ikatoka community health workers ikakuja community health volunteer, na sasa hizi imekuja ikaitwa community health promoters. Mbagi iko na kila kitu mahali pale. Mimi ninapofika mahali pale niko na mashini ambayo inatumia kuangalia wale ambao wako na sukari. Niko na mashini ambaye pia ni blood pressure ambaye inaweza kupima. Ukiona huyu mama ako na blood pressure unaweza kumrefer kwa hospitali. Tuko na mashini nyingine ambayo ni weighing machine ambaye ni ya watu wakubwa, ya watoto. Tukiwa mahali pale unaweza pima kilo. Tuko na mwaka ya kuangalia huyu mtoto afya yake inaendelea namna gani. Mwaka yake ikiwa iko green, mtoto ako normal. Mwaka yake ikiwa iko moderate, huko ako at least ako borderline. Akiwa ako red, huko ako severe, una refer kwa hospitali. Kwa hivyo hii bag imebeba kiti zote ambazo zinahitajika kwa hospitali. Pia tuko na first aid kit ambaye mama mimi ameanguka huko ama kuna kitu imefanyika huko, uko rende kukimbia mahali pale na kuwasaidia na pia kurifaa kwa hospitali. So nikiwa mahali pale nitazuia magonjwa mengine ili wasiweze kuja msongamano hapa kwa hospitali.
Thank you so much back at home for taking the time to join us today in the show. We hope that you've learned a lot in as far as community health strategy is concerned. So when you see the community health promoters come to your home, do welcome them, because all they're trying to do is to help you, prevent diseases and eventually, yes, save you some cash in case you get ill. So thank you once again. My name is Yambo. We hope to see you again next.